Yeah. Next, we have Dr. Sarika S. She'll be talking on hyperreflective cystoid diabetic maculopathy, patient profile and treatment response.
Good morning. My paper is on hyperreflective cystoidiabetic maculopathy, patient profile and treatment response. Hyperreflective cystoidiabetic macular edema is defined as cystoid spaces completely or partially filled with grayish irregular hyperreflective material without backshadowing in the OCT B-scan cross-sectional images. And the importance is it is resistant to treatment and there is a risk of subfoveal migration. And the OCT angiography imaging has detected an extravascular decorrelation signal corresponding to the presence of these hyperreflective contents within the cystoid spaces, and it is called suspended scattering particles in motion. Aim is to study the clinical profile of patients with hyperreflective cystoidiabetic maculopathy and their treatment response over one year, and to evaluate the mean change in best-corrected visual acuity, central foveal thickness in OCT, and to assess significance of OCT octa biomarkers following treatment. It's a prospective observational study from June 2022 to November 2023. 64 eyes of 49 patients were included. Inclusion criteria: cases of hyperreflective cystoid center involving diabetic macular edema and eyes with non-tractional DME and willing for a minimum of 1 year follow-up. Excluded taut posterior hyaloid, vitreomacular traction, proliferative diabetic retinopathy, glaucoma, any other non-retinal or optic nerve pathology. And data collected were age, duration of diabetes, associated medical conditions, best-corrected visual acuity at presentation and final follow-up, intraocular pressure, central foveal thickness at presentation and final follow-up, and it is measured with manual caliper tool in the using the Heidelberg spectralis machine. An evaluation of macular ischemia and demonstration of suspended scattering particles in motion by octa was also done. This is octa image showing superficial and deep foveal avascular zone. And the anti-VEGF was dexamethasone implant injections on a pro-rata basis done during the course of the study according to physician discretion. And anti-VEGF injections were given in 35 eyes and OCTs injection given in 29 eyes. Coming to results, the mean age of the study population was 64.6 years and mean duration of diabetes is around 18 years in both the groups. And coming to the distribution of comorbidities, hypertension and dyslipidemia were more in these eyes. A number of injections in the dexamethasone group was 1.96 and in the anti-VEGF was 4.5. A number of visits in the both groups was around 7. And the association of best-corrected visual acuity and central foveal thickness at baseline and follow both the treatments significantly improved best-corrected visual acuity and reduced the central foveal thickness. And the association of foveal avascular zone at baseline and follow-up, there is no change in foveal avascular zone from baseline to follow-up. And the deep capillary plexus size was more than superficial capillary plexus size. And the BCVA change and central foveal thickness change was more in the dexamethasone implant group. And the distribution of SSPIM, total of 51.6% noted SSPIM, and on follow-up SSPIM reduced and the reduction is more in the anti-VEGF group. And the raise in IOP at 1 year follow-up noted in 31% in the dexamethasone implant group and none in the anti-VEGF group. Our observations: the prevalence of hypertension and dyslipidemia were more in these eyes with hyperreflective cystoidiabetic macular edema, and during 1 year follow-up, both anti-VEGF and dexamethasone implant showed a significant reduction in central foveal thickness and improvement in best-corrected visual acuity were comparable in both the groups. Less number of injections were done in dexamethasone implant group and mean number of visits were almost same in both the groups, and no subfoveal migration of contents of cyst noted. In our study, the prevalence of hypertension and dyslipidemia were more. And study by Ramesh et al. They studied hyperreflective and non-hyperreflective cystoidiabetic macular edema and they noted no association of other medical conditions. And in our study, the 31% OCTs group had IOP spike, which is similar to Dougal et al. Study. And in our study, the mean baseline vision and central foveal thickness reduction was there. Mean baseline vision improvement was there, which is similar to Liang et al. Study. And in our study, the deep capillary plexus pore size is larger than superficial capillary plexus size, and it was similar to Koskas et al. Study. In our study, the anti-VEGF group received more injections than DEX group, which is similar to Shah et al. And Gillis et al. Study. In our study, this SSPM decreased in follow-up in both the groups with more decrease noted with anti-VEGF injection. And in Parvanov et al. Study, the SSPM continued to persist even after multiple DEX implants. indicating severe blood retinal barrier breakdown. And coming to the cost of the therapy, for 1 year, for anti-VEGF, the mean number of injections was 4.5, and around 1 lakh rupees is the cost for anti-VEGF, and dexamethasone implant is around 77,000. And coming to conclusion, hyperreflective cystodiabetic macular edema responds equally to both anti-VEGF and dexamethasone implant, and this study highlights the beneficial role of steroids, as lesser injections are required to manage these eyes, lead to better patient complaints and less financial burden to the patient. These are my references. Thank you.
The cost factor will depend on the type of macular.
Yes, sir.
Some may not respond to bevacizumab, some have to go for
This is ranibizumab only taken, sir.
bevacizumab will be lesser.
Yes.
Thank you.
Okay, thanks.